lockdowns at the Charlotte Maxeke Academic Hospital are expected to continue until late 2023. Last year, a group of medical staff wrote a letter requesting intervention from the National Health Department and the President. Now, the provincial government has confirmed that the National Health Department will assist with the project going forward. Let's speak about this with Head of Internal Medicine at Charlotte Maxeke, Professor Mahomed. Prof, a very good evening to you. Thank you so much for being on the program tonight. So, finally, intervention from national government in the situation at Charlotte Maxeke Academic Hospital. Is this the intervention, though, that you had in mind as healthcare workers when you wrote that letter last year?
Good evening, and good evening to your viewers as well. I think this is a positive response from the Gauteng and National Department of Health. However, I am really skeptical and cautious of being too overexcited about this, because one has to be cautious, because there has been promises and projections done previously and nothing has come of it. I do think there needs to be more transparency, and my concern is you're saying that you're going to do this by end of 2023, yet you don't have a budget or a full costing done. So I'm not sure how one can give a deadline without having all the variables analyzed. So I am concerned. I am happy that at least we're moving in the right direction. But I think as viewers, patients, and concerned clinicians, we still need to maintain pressure and observe and monitor what's happening.
And give us an idea then, Prof, of the day-to-day impact on yourselves as staff and patients from the limited sections of Charlotte that are still operating.
So I think there's a number of aspects that we have to highlight. Firstly, the Johannesburg Hospital is a tertiary hospital, and it's about the type of care that we give. Our outpatients are currently running at under 50%, and our inpatients, we've lost close to 25% of our beds. And these are not just simple, ordinary beds. We're talking about highly specialized care. We've lost 40 psychiatric beds. We've lost the cardiothoracic ICU and general ICU, the cardiology ICU. And all of these little pockets of ICUs has a direct impact on southern Gauteng. And from a day-to-day functioning, the numbers that we are seeing are reduced. And the question I ask is, where are all these other 50% of patients going? We had a high occupancy rate. Where are all these patients going? And my concern is they are overwhelming an already burdened system. You've seen reports of Helen Joseph Hospital and Chris Hani Baragwanath Hospital. I have colleagues there, and we're one Department of Internal Medicine, and they are under immense pressure. There's challenges in every hospital. And the National Department of Health, Gauteng Department of Health, should use this opportunity, not just to focus on CMJH, which is a crisis, but there's crises in every single institution, and we're not giving patients the best possible care. We need to stand up and take ownership of the fact that we're giving mediocrity care. Let's take that and build from there.
And we speak about the fire at Charlotte, we talk about infrastructure, we talk about the unhappiness of professionals, the lack of money to sort things out. But as you point out, there's very much a human cost on the back of what's happened.
So the emotional burden of COVID, on top of that a fire, has taken the toll on the healthcare workers at Charlotte Maxeke. But this effect has also been on the surrounding hospitals as well. My hospital, my department, we work at Verthagoa Hospital in Germiston. We work at Edenvale Hospital. I have good relationships with Helen Joseph Hospital as well as Chris Hani Baragwanath Hospital. All of these hospitals, the healthcare workers are under immense pressure. We've lost close to 30-40% staff from the trauma nursing care. And these are highly specialized nurses. And during the time of the fire, all the healthcare workers were running across Gauteng, seeing to patients at different institutions, leaving home early in the morning, getting back late at night, with no real acknowledgement or appreciation from their employer. And I'm sorry, we could have done better for our healthcare workers. And healthcare workers means the general assistants, the clerks, the porters, the cleaners. It's not just about the doctor or the nurse. It's the entire team that's feeling the burden of this, and it's going on too long. And it's taken 10 months to get to this point when 6 weeks after the fire, we've raised the red flag to both National Department and the Gauteng Department. I guess it's better late than never, and that's where we are right now. Hopefully we'll get move in a forward direction.
On that then, Professor Mahomed, how free-flowing has communication been between medical workers and government on these issues at Charlotte Maxeke and the other hospitals which have subsequently been affected by the redirection, shall we say, of patients? Are they speaking to you directly, or are you also having to find out information with the rest of us when there are these briefings, as happened yesterday?
So I think there's a very small select group of people that know what's happening. But if you're talking for the masses of workers at CMJH and the healthcare workers in Southern Gauteng, the transfer of information, the transfer of deadlines, and what are we going to do, how can we help you, is close to 0%. It's very frustrating when the entire of December we highlight the issues of parking. The contract that you've had with parking near the Johannesburg Hospital is coming to an end. No, it will be sorted out by January. We come to now towards the end of February. We're still having challenges of parking. I know one of the issues that have been addressed by the National Department of Health spokesperson was the parking. So you're telling us you're addressing the parking, you're doing feasibility of parking, and you're trying to fix it up. But the point is, you don't have a plan in action today. You haven't started fixing up the parking. You're making life miserable for patients and staff. And coming to work and waiting for 90 minutes for parking, you're not going to have a good day. Patients are not going to get a good feeling when they have to walk half a kilometer to a kilometer to get to the hospital. And Charlotte Maxeke is a long hospital. Within the hospital, you can walk up to a kilometer to get to see a doctor. So the softness and gentleness of our healthcare system is not there. And information is not free-flowing. I mean, the media briefing was to media first. This information will now then go second-hand to the staff, which should have been the other way around. In my personal opinion, staff should have been addressed directly by our employer rather than via the media.
Could the situation drive more doctors, more nurses out of the public sector at least, or the profession altogether?
I think if you put in COVID and the effects of COVID on healthcare workers, plus the stresses of being in an unfriendly environment, we have a recipe for more and more staff leaving. Besides staff just leaving and going into private sector, lots of nurses and other healthcare workers, as soon as they get near early retirement, they're taking early retirement. You have people taking retirement at age 58 and 60, where you could easily carry on till age 65. But why suffer? Why struggle? Why be in a place that's unhappy when you can just rather stay at home and be content with that little income you're getting than to carry on with the burden that we're currently under? The enormity is unbelievable. It's just not service to patients. It has affected the academic platform for teaching of future doctors in this country. This is setting us back. And Wits University has one of the largest imprints in making specialists. And this has taken a real knock, and we need to somehow get back on our feet and not do so much lip service.
What's being done for those students, those medical students in the interim? Where are they being sent to?
So a lot of the students, their workload were, again, it was placed initially on the other hospitals to pick up the workload. So again, these hospitals, Chris Hani Baragwanath, Helen Joseph Hospital, they also initially picked up a lot of the academic workload. Currently, we are doing a lot of teaching at other hospitals like Bertha Gower Hospital, Edenvale Hospital, and that's because of the initiative of the doctors and the nurses and the students. We can get more support from government, both at national level and Gauteng Department of Health, to improve teaching and give more resources for teaching. And this is not just about doctors. This is about nursing education, allied health, physiotherapists, occupational therapists. Everyone is feeling the burden and challenge of this effect on Johannesburg Hospital.
And if medical workers are retiring, as you say, in their late 50s, instead of waiting for 65, for example, that then robs even the new cohort of nurses and doctors of an opportunity, doesn't it, to learn from people who've got 20, 30 years experience.
You're 100% right about that. Can you imagine when someone is looking forward to retirement and they're age 50? There's something wrong in the system when someone is counting, oh, I only got 1 year left to get to retirement, and that's 58. And that's the type of person that's actually at their peak of teaching and mentoring and giving their skill set. And we're losing a lot of these staff almost on a weekly basis. And the challenge is to replace the staff, the bureaucracy, the red tape. You would pull out your hair if you have to know about the HR practices of appointing people. We have COVID appointments that are coming to the end of March, and they're not going to be renewed. We have a healthcare system that takes forever to appoint people. So one thing that we're very good in, at least in my hospital, is red tape and bureaucracy. And that also puts burden on healthcare workers.
One of the other troubling issues is that I think a psychiatry ward, I believe, was also among the affected areas. That would have housed normally around 40 patients. That's not the kind of care that should be compromised at any point in the chain.
So the healthcare users situation is dismal in southern Gauteng. We lost 40 specific dedicated beds. Yes, they did open up a ward at Helen Joseph for extra psychiatric beds, but we still hundreds of beds short for this vulnerable group of patients.
And who
this
would
has
these
been raised by the psychiatrists.
Pardon me, I just want, for clarity's sake, give us an idea of who would be treated in such a ward.
So you have patients who have substance abuse, you have patients who have underlying chronic psychiatric illnesses like severe depression, manic episodes, schizophrenics, bipolar mood disorders, people at high risk for suicide, people that are going through a lot of physical and emotional things presenting as a psychiatric illness, the chronic. We also had an outpatient department, and a lot of these patients who are very hard to challenging to treat, all of a sudden you take them out, they can't get to their chronic medication scripts. And we're having a lot of patients now that are not on their treatment are presenting in severe relapses to these other hospitals. The psychiatric system at Helen Joseph Hospital and Baragwanath is on the brink of collapse, and we need more and more beds for southern Gauteng. There is a plan out there, but again, nobody is putting pen to paper and putting money where it needs to be done. We had the life epidemic and everything is going on, but there's still no accountability to say, here's a project, here's what you need to spend. Yes, money we need to spend, and we know how much money we've had because you could see all the illegal stuff happening. So we have money, we just need to spend it appropriately, honestly, and fairly for those that need.
Professor Mahomed, such a pleasure to have your time. Unfortunate situation that you and the patients are having to deal with. We hope it gets better soon, but thank you so much for being on the program tonight.
Thank you so much, and good evening.
Dr. Mahomed is the head of internal medicine at Charlotte Maxeke Hospital, Professor Adam Mahomed.